And tonight, time is running out. The cry of professional health groups who are appealing to the Ministry of Health to immediately commence processes for the procurement of 3 essential vaccines, which are in short supply in almost all public hospitals across the country. Already 16 districts in the north parts of the country have recorded cases of measles, which could have been prevented if these essential drugs were made available by the ministry. Well, Joy News' Mami A.C. Thompson tells the story of how many more lactating mothers have been crisscrossing the country, facing difficulties in immunizing these toddlers.
After a month, nursing mother Florence Kwabla is back to the vaccination center at the Adabraka Polyclinic with her baby girl, Gladys. Florence is here to get Gladys' weight checked and her vaccination shot. She recorded a healthy weight. However, the oral polio vaccine due her is still not available for her baby. The last time she was here, she was told it was finished.
With the polio worries me a lot because the first day we came, they said there's a shortage. Then 1 month time we came, they said there's a shortage. So I asked them, is there any available at any? But they said there's still shortage at some of the polyclinics and hospitals.
Another worried mother is Gifty Odonko. Her 4-month-old baby Inshira has also not received the polio and the rotavirus vaccines. She wants government to quickly restock.
I'm
told there is no polio vaccine, so we'd have to return without the shot. It could expose her to diseases. I hope we can get it at the pharmacy to protect her.
Parliament's Health Committee took a strong stand to deal with shortages across the country. Committee Chair Dr. Efriye Ayu agrees that no child should be exempt from vaccination.
We are concerned because every life matters. And just as many of us here feel our sustainability has more been because of the vaccines we had at childbirth. We cannot deprive any Ghanaian that opportunity to live. And the absence of vaccines in the committee's thinking is inexcusable or unpardonable.
Well, the Ghana Health Service Director, Dr. Patrick Kumar-Bwaji, has assured stores will be replenished in 2 weeks.
Meanwhile, the Pediatric Society of Ghana says time is running out. President-elect of the group, Dr. Hilda Mantebia-Boli, says the Ministry of Health must take immediate steps to address the challenge.
Yes, I mean, there were reports of a few one-offs, but then if other facilities have it, then people just go there. So it wasn't anything major until suddenly we realized that it was widespread. And that is when people also started having the infections and all, and so we had to also come out.
So you intentionally didn't inform the authorities?
No. Okay. So if we are looking at responsibility, whose job it is to ensure that there are no shortages of vaccines, right. The Ministry of Health, like you mentioned, I mean, they have that oversight. The government, they have that oversight, okay? So they have to, they work with the EPI, they work with all the relevant bodies, and they work with the various facilities as well to ensure that we have stock. I dare say that it's somebody's job to ensure that we do not get to this point where people are recording shortages, because we've been running this for many years in this country. And if somehow every time we have had vaccines, how come this time we don't have vaccines or there are shortages? I mean, you can't tell me that we couldn't predict that exchange rates was becoming a problem, that funds was becoming a problem. And generally all over the country now, we know that all over the world there are hardships, but we are saying that the children should be prioritized. And whoever is supposed to ensure that budgeting for vaccines is done, the monetary allocation is there, should do their job and make sure that they are there, because already we have an issue with malnutrition because of the hardships, the current hardships. How much is an egg today? How much is meat today, a pound of meat? fish. I mean, how are people going to, and all these, you see, when your immune system goes down, then you are more likely to have infections. And so we as a society are already worried about malnutrition and all those other social problems that are developing as a result of the hardship. Right. And this vaccine issue is only going to compound things, because you have children who have some background malnutrition, their immune systems are already down, and they are not getting the vaccines that they need to help them to even prevent them from getting the infection. So we are heading into a dangerous zone. We are talking now, and we'll be talking more and more. And even if you get it, you are likely to get a milder form compared to somebody who hasn't been vaccinated. And that is why it's really important. The BCG vaccine, which is for tuberculosis, for example, when we give the BCG vaccine, it doesn't prevent the children from getting tuberculosis at all. It just prevents them from getting like very severe forms or forms that spread. So let's say to the brain, to the bones, it prevents them from getting such kinds of tuberculosis. So it's really about protection, and it's like maximal protection in some cases and very good protection to prevent totally in other cases. This is a public health intervention. Somebody's illness can infect you, and you could have your money, but you could die. Right. And many children come from homes where there's not enough money. We know we have NHIS, but even that we have problems. And we are even hoping that children under 5 years of age will have health care for free. Please don't think of asking people to pay for vaccines, because it will be a public health disaster. As it stands, even with this shortage, look at what we are seeing. How much more if we go to a point where we have the vaccines, but people are not able to afford it? This, please, nobody should talk about.
So it's a no-go area for in terms of the payment?
Yes, it's a no-go area. I do not think that children should be asked to pay for vaccines. No, not at all. It's the least that the government can do for its future. Protect your children. How hard is that?
And that's a plea from the Pediatric Society. Let's try and get some answers now. Joining us is Isaac Ofeiba. He's Public Relations Officer at the Ministry of Health. Thank you, sir, for your time here on Joy News Prime. The Health Minister, as we understand, was unable to answer questions in relation to this particular issue last week. Are you able to explain to us what accounted for that?
Good evening to your cherished viewers. And I must say that the Ministry of Health has taken notice of the shortage of the vaccines in the system. And I would also want to say that the Honorable Minister, Honorable Pekwa, personally has taken the issue to ensure to deal with it, to make sure that as soon as possible, the Ghana Health Service, the people of Ghana, will receive the vaccines in adequacy.
So what you mean to say is that the minister will soon appear before Parliament?
Yes. The last time, the Honorable Minister was indisposed. He was indisposed. In lieu of that, the ministry wrote back to Parliament to inform them that the Honorable Minister was indisposed, and that if we could arrange for a different day, as we speak, the Honorable Minister will be in Parliament tomorrow to address and explain the issue, for everybody to understand that it is not a deliberate attempt that the Honorable Minister really want to be in Parliament. One, he was indisposed. Two, he is on top of issues regarding this vaccine. He is working tirelessly to ensure that we have the vaccines in adequacy, so that the children of Ghana, the future of Ghana, is restored. And so this is one thing that we want to assure Ghanaians, that the Ministry of Health is ready and working hard to ensure that we have these vaccines.
There are some media reports making the rounds. Of course, we're hearing, for instance, that the Ghana Health Service is attributing this shortage to, for instance, the depreciation of the Ghana cedi. How true are these reports, for instance?
I'm not privy to that report, but however, what I will say is that procurement of vaccines takes a process. There are a number of processes involved, from the Ministry of Health to UNICEF, Gavi. There are a number of processes involved. So one way or the other, there could be a technical delay. These are part of issues that the Honorable Minister himself would speak to them on the floor of Parliament tomorrow. And on that issue, I will reserve that explanation for him, because some of the issues that are coming up are new to him. As I speak to you last week, he summoned a complete meeting on this same issue. That let's look at how best and how possible. Let's stop whatever we are doing as a ministry and make sure that as soon as possible we have these vaccines in the system. Don't forget that there are a number of vaccines that we need as a country. Now, we have COVID-19 vaccines in storage. We have other vaccines in storage. And so he will be there tomorrow, put everything on the table, and everybody will understand that it's not a deliberate attempt that we want to deny, or the Honorable Minister or the Ministry want to deny the people of Ghana the vaccines, but rather technical issues which will be explained to him tomorrow on the floor of Parliament.
Well, it may not just be about the ministry, but also parents who are out there, and many of them are becoming very anxious. What do you have to say to these lactating mothers and also the family members who are getting worried that this situation might get out of control?
You see, like I said, Honorable Minister himself is a family man. Every member of the ministry, all management members are all family members, family men who have their children involved in some of this shortage or that. But we are appealing to the general public, educating mothers, parents, to exercise patience, and then we are assuring them that as early as possible. Right now, the concentration is on the vaccines, how we can get vaccines distributed to the various hospitals so that parents can get access to them. What we would rather say is that they should be available, they should make themselves available for the dose as they are invited that the vaccines are arrived. Because there are instances where vaccines are there and you are finding it difficult to get people to take the dose. But this one, we first of all want to encourage them and entreat them to make themselves available. Because we are assuring them that by tomorrow, the Honorable Minister himself will state clearly when we should expect the vaccines. And I know from the point that I'm speaking that he's working tirelessly and will ensure that we receive the vaccine. So parents are to be on that. Once the vaccine comes, we encourage everybody to go and take the vaccines. We are all aware of the challenges and the challenges that we are facing. And so we are pleading with the system that whatever the situation, vaccines will arise, and we are encouraging them to make themselves available. Let's not forget to appreciate the effort of the Ghana Health Service, what they are doing to safeguard the system. They are working tirelessly, they are all contributing their quota, and they need to be recommended as well.
And already, some of the health groups are beginning to make suggestions as to how to prevent this from recurring. For instance, the Pediatric Society making a recommendation that we create a ring-fence fund for these essential vaccines, a situation which will make them, the funding and the monies for them, untouchable. What are you able to say on that recommendation that we set aside funding for this?
Yes, I think that I side with them. In every incident, there is the need for us to take a clue or learn something out of. And so whatever possible leads to this particular shortage, it means that the ministry would have to take note, and we have already taken note of it. Like I said, the Honorable Minister himself will be on the floor of Parliament, and I can assure you that this shortage of vaccines will never occur to the people of Ghana again. It will never happen again.
You're making a promise? You're making a promise to the people of Ghana?
I can assure you on that, because I know what management is doing. I know what the minister is doing. I know what the chief director is doing. I know the effort that every member of management is putting to ensure. And like I said, let's deal with the issue. Sometimes it's being dealt with personally, that somebody is not doing something well. It's a process. We get the vaccines from outside. We are supposed to procurement processes. There are some times you might not get it right. There are times you might get it right. When we get it right, we should be praised. When we don't get it right and we are being criticized, no problem about that. But we shouldn't personalize. This is a system that has been with us all the time, and it is the same system we are going to use to make sure that we restore the sanity in the system. I can give you the assurance that we have taken a clue of the technical challenge we have, and we are going to work on it as early as possible, and this will never repeat itself.
Okay, then we'll leave it here for now. Isaac Ofeba, Public Relations Officer at the Ministry of Health, would also be looking forward to that address by the Minister of Health tomorrow.